Welcome to the Mindful Practice Podcast, a space for physicians navigating burnout, identity shifts, and career change without pressure or judgment. I'm your host, Dr. Bertina Hooks, a board-certified internal medicine physician, coach, and writer. Here we talk honestly about what it means to build a sustainable career and a life beyond medicine and survival. From fire to freedom, why I created the Mindful Practice Podcast. Hello, and welcome to the Mindful Practice Podcast. My name is Dr. Bertina Hooks. I'm a board-certified internal medicine physician, certified life and business coach, entrepreneur, writer, and speaker. But today, I'm not here to teach or share my medical expertise. I'm here as someone who almost disappeared inside of medicine and had to rebuild her life, identity, and career from the ground up. This podcast is for physicians who feel exhausted, unseen, unheard, or quietly wondering if the life they're living is sustainable. If you've ever asked yourself, is this really what I work so hard for? You are exactly who this space is for. So, as you're coming home from work or charting at home, listen to this podcast. And this is a safe space for you to be heard, be seen, and validated. Who I was before medicine. I didn't go into medicine for prestige. I went into medicine because I wanted to heal. I wanted to help people. And from an early age, I believed that if I worked hard enough, sacrificed enough, and stayed quiet enough, I would belong. And for a while, that belief worked. I earned the advanced degrees, the credentials, the white coat. But along the way, I absorbed some unspoken rules. That exhaustion is normal. That silence was strength. That pain, especially my pain, was weakness. So I learned to push through, to override my body, to minimize my needs, to normalize what was slowly breaking me. When burnout became my normal. In 2011, I finished my internal medicine residency and started working as a full-time hospitalist. When I started my medical career, I was optimistic and motivated to save the world. However, by 2016, started to experience burnout early in my career. I remember one shift as a full-time hospitalist vividly. I was working on the oncology floor, seeing more than 20 patients in that single day, each patient more complex than the last. At the end of the day, I had promised to do a family conference with a patient who had advanced cancer. And despite all of the medical treatments, her cancer had progressed. And we had unfortunately run out of treatment options. So the family conference was to discuss palliative care and hospice to allow the patient to have quality of life with whatever time she had left. I had just finished rounds when I sat with the patient and her family to explain that despite surgery, chemotherapy, and radiation, her cancer had progressed. We were out of treatment options. Delivering bad news as a physician is sacred work, but it's also heavy. Each time we speak with a patient, as human beings, some of that energy is transferred to us, and that transference is something that we have to process those emotions with each patient encounter. When I stepped out of the room, I leaned against the wall and caught my reflection in the mirrored hallway. My eyes were bloodshot, my scrubs were wrinkled, my white coat was dirty. It was 6:30 p.m., and I was on call until 11. I was physically exhausted, emotionally hollow, and starting to feel detached. Not because I didn't care about my patients, but I cared too long, too much, without support. That is what physician burnout actually looks like. I was physically and emotionally exhausted. I was feeling cynical and detached. My stomach growled because I had to skip lunch to finish rounds and charting, as well as my coding queries and tasks in Epic. I headed to the nutrition room to grab a quick snack of peanut butter, crackers, and coffee while finishing my charting in the doctor's lounge. As I sat there, I started to contemplate about my career over the last 5 years. Earlier in my career, I used to have an adrenaline rush when I was on call, anticipating the next patient, but now I dreaded my call shifts, wandering through the crowded emergency room to locate the next patient being admitted. Each patient encounter was emotionally draining, and it was hard to recover before dealing with the next life or death crisis. The paperwork was endless. As soon as I finished my charting, there was billing to do, along with queries and other administrative tasks. I knew I did not have much time until the next admission arrived on the floor. I desperately wanted to have time to call my daughter Bianca and wish her a good night before she went to bed, but I had to call in a few consults and finish charting and billing and attempting to eat something before I was paged. I was grateful that tonight would be the last day of a week-long shift, and I would be able to sleep in and spend time with my family and eat on a more consistent basis. Instead of enjoying my days off, I often had no energy to get out of bed for the next few days. It was harder to bounce back. And when my break was over, I was not refreshed and dreading returning to work. Furthermore, the administrative load was unbearable. The constant paperwork, the constant queries were becoming overwhelming. I did not feel I was using my medical degree at its optimum. The administration had recently refused to approve our pay raise, and that really had lowered team morale. Our hospitalist group was well respected among the consultants, and we had great patient satisfaction scores and low incidence rates. Despite our productivity, our compensation did not match. Many of my colleagues had contemplated leaving the group and medicine altogether. I was considering it even though I enjoyed medicine. I enjoyed my job, but I was feeling more dissatisfied and undervalued. After 5 years of practicing medicine, I was thinking about leaving it altogether. After all the years of sacrifice, this was the only career I had ever envisioned for myself. Ever since I was young, I had wanted to be a physician to help people. I had sacrificed years studying and preparing for this moment, but it was not what I thought it would be. What physician burnout really is. Burnout is not weakness. It is a psychological syndrome caused by chronic workplace stress, defined by emotional exhaustion, physical exhaustion, depersonalization or cynicism, and a reduced sense of accomplishment. Over 40 to 60% of physicians experience burnout at some point in their careers, from medical school until they become an attending. And burnout is not a personal failure. It is systemic. It is driven by overwhelming workloads, administrative burden, lack of autonomy, moral injury. No amount of resilience can fix a broken system. And yet, most physicians blame themselves when this really is a systems issue. And burnout can occur in other high pressure and demanding jobs like medicine. And it often requires physicians to recognize the signs of burnout and to start a burnout recovery plan in order to build resistance and wellness. The night everything changed. In December 2022, my body stopped whispering. After working a hospital shift, I collapsed at home. My daughter called 911, and the ambulance rushed me to the nearest hospital. There, when I arrived in the emergency room, a sepsis alert was called. I was diagnosed with strep necrotizing fasciitis, a catastrophic, life-threatening infection. IV lines were placed, antibiotics were started, and then the orthopedic surgeon said the words, "You need an emergent below-the-knee amputation to save your life." I had been delivered life-altering news, and I had delivered that same news to patients in the past. But receiving it was different. I was the patient, not the physician. In that moment, that life-altering moment, I realized that my life would change forever. However, I didn't know that ironically, it would change for the better. I decided to save my life and opted for the right below the knee amputation. The next day, I woke up missing part of my body. And suddenly, I wasn't just navigating burnout. I was navigating survival, disability, and identity loss. Why this podcast exists. After survival, there's often silence. People congratulate you for being alive, but no one teaches you how to be reborn again. Losing part of my body correlated with losing part of my identity. I had to ask myself, who am I if I can't practice medicine the way I used to? Who am I without productivity as my worth? Those questions led me to rebuild, not abandon medicine. Many people in the medical community told me that I could not practice again, even though I was young and able to walk again and become independent again over time. I decided that my worth was more than what I did as a profession. My worth was essentially who I was, my core values. In reconnecting with myself and my core values, I was able to gain career clarity and to reinvent my career. I started to do a career pivot into non-clinical medicine as well as clinical medicine for my own peace of mind and fulfillment. These non-clinical career paths align with my core values. Through utilization management, medical expert work, telemedicine, locums, coaching, writing, I was able to redefine who I was as an individual and a physician. This podcast exists because I don't want other physicians to feel alone with these questions. I don't want another physician to feel that their worth is only defined by what they do, by their productivity. I want physicians to redefine how they practice medicine based on who they are and what they want in their life and career. Here we talk honestly about burnout, identity, career design, and choosing sustainability over survival, sovereignty over struggle, and inner peace and strength over silence. I hope that by sharing my story with you and my experiences with burnout, you will better understand how you can identify and assess burnout in your life and put steps into place to recover from burnout and build resistance and wellness. In addition, I hope that this podcast will also show you other career paths and alternatives that align with your core values and identity, and that this will give you the career clarity that you need to pursue a career in medicine that is in alignment with your personal values and goals. We chose medicine to make a difference and an impact, and you can do that as a physician practicing clinical medicine or as a physician doing non-clinical pursuits. The choice is yours, and there is no right or wrong answer. The answer lies within you. By doing therapy, coaching, and receiving support from other physicians, you can determine what your professional identity is, reclaim it, and pursue a career that will be satisfying and impactful. Thank you again for spending time with me today on this first episode of the Mindful Practice podcast. I hope that there was a lot of value and strength in what I shared with you today. I hope that if this resonated with you, you will subscribe and follow me on social media. Thank you again, and have a wonderful day. Thank you for listening to the Mindful Practice Podcast. If today's episode resonated with you, you can find free burnout and career clarity resources at pinnaclebusinessacademy.org. And if this podcast supported you, please consider subscribing or sharing it with a colleague who might need it. Remember, you are more than your white coat. You are not broken, and you are allowed to evolve. Until next time, take care of yourself, not just your role.